We're really excited about Smartboard technology in our patient rooms. Currently, we're using whiteboards and dry erase markers and erasers to update information about physician coverage, estimated discharge date, dietary needs, any kinds of other patient information that might be relevant to their care or for their family's information. And it's only as good as who's written it at the time. The Smartboard technology will allow us to make real-time updates for what the patient needs, keeping the patient informed in what's happening so that we're working through a more modern experience that is reducing some of that manual update process that we're currently using. So improving the workflow with technology and updated smart whiteboards allows us to update things one time in a computer that will continue to flow, keeping the patient and their family updated with who's on their team, what they need to know about their care, and any other relevant information such as when they're discharging. It all happens through a technology platform. So it's real time, it's a seamless process using technology we don't currently have available, and it'll make the experience for our teams working with these patients a better experience and reducing some of that wasted time drawing on whiteboards.
So one thing that we learned during the pandemic was it was really hard to connect families with their loved ones when they were in the hospital, especially with all the restrictions that we had, of course. So we did the best we could with the technology that we had. We had iPads that would be provided. The staff would go in or the chaplain would go in and connect the patient with the family. But these will help us do that without having to bring extra equipment into the rooms. The family should be able to just, sometimes they can listen in on the physician's discussion with the patient or the nurses. The patient can talk to their family. The family, when they come in, say they miss the doctor or they're not sure who the doctor is, they can look at the whiteboard. They'll see who the doctor is, who the nurse is taking care of their loved one today. They will see a picture, so they'll even know who to look for. So it'll keep the families more up to date on what's going on with their loved one when they're in the hospital if they can't be here with them. I just think this is a really, really great thing that we're going to bring to our patients. It will allow the patients to connect with everybody that comes in contact with them. It'll keep their families informed. And, you know, as a family member who has spent time in the hospital with a loved one, I think it'll be really amazing for them to know more of what's going on and who's been in the room and, you know, what to expect.